So, Dr. Pramomo and I always make an effort to ensure that the surgery we're moving forward with you is unique and catered to you based on your medical comorbidities, your desires for weight loss, your expectations, and we also make sure that you understand kind of the differences between the two. I would say that the most commonly asked question is what are the benefits of and what's the difference between the sleeve and the bypass? Because those tend to be the most common surgeries that are performed now for weight loss surgery.
And I think it's very important to have that discussion. The reality is we actually have a lot of data to help guide us on this. And something like the gastric bypass, we've got data out 10, 15 years down the road. Something like the sleeve, we have actually very robust data, but data that we can kind of very much trust 6 to maybe 10 years down the road. But we always usually look at that data that's about 6 years down the road. And I think the biggest thing to understand is that these are both tools. Always talk to patients that, we wish we had this one magic bullet that would be a cure-all for everything. But the reality is these are tools, and I think that when you view them like that, what we see the sleeve as is a very effective tool, usually for patients that are younger, usually for patients that have, moderate to lower BMIs, maybe a BMI, body mass index, less than 40, 45. And then also maybe patients that are not struggling as much with things like diabetes or reflux. Whereas the gastric bypass seems to be doing very well for patients with diabetes, certainly very well for patients who have significant reflux disease requiring medications for that.
And also a very good tool for patients that struggle with severe reflux. Because we have seen in the data that when we do sleeves on patients, sometimes we can actually worsen their reflux. But that's why these conversations with your surgeon are so important to make sure that we're catering to you as an individual and truly giving you the best tool that's going to make you as effective as possible, not only your weight loss journey, but in your overall health.
And I think when you're comparing these two together, again, it's going to be very individualized. What we do see is that when you compare the sleeve to the bypass at that 6-year data, both patients are doing very well. What we do start seeing, though, is that there is some weight regain issues within the sleeve patient population, a little bit more so than the bypass. Again, it's not to say that it's a bad tool, but I think it's a tool that requires more work. A tool to make sure that we are adhering to those lifestyle changes and that different relationship with food that we're trying to instill.